My name is Dr. Rita Agapitomori. I've been working about 32 years at the Duke State Hospital and 29 years as an obstetrician and gynecologist. I am going to talk about the antenatal services in Duke State Hospital. First, I will introduce what I will cover in my presentation. This presentation will be covered with the goal and purpose of the antenatal services, the antenatal care schedule, and all the basic skills for antenatal care include pregnant well, Leopold maneuver, feeder heart rate, and measurement of the fundal height. The goal of the antenatal services is to care for mother and fetus during pregnancy to ensure optimal health for both the mother and the baby from conception to delivery. That's the goal. The purpose of the antenatal services is to provide care for the pregnant mother with 8 visits throughout her pregnancy for both non-health and health emergencies. We screen for unhealthy conditions, which is related to adverse health outcomes during pregnancy and childbirth. We also provide therapeutic interventions which are known to be beneficial to mother and the fetus. It's also to alert the pregnant woman with complexity to emergency and instructing them about appropriate response. In antenatal care schedule, the minimum number of visits here in Duke is 4. However, it is recommended to provide around 8 antenatal checkups. First and second visits are conducted in public health. Subsequent visits are conducted in the dispensaries. The high-risk pregnant women are seen in public health by physicians and obstetricians. The low-risk pregnant women are seen in dispensaries by the health assistants and the nurses. The schedule for the revisit is every 4 weeks from conception up to 27 weeks. 28 to 36 weeks is every week, and 37 until delivery is every week. In the first visit, first they come in and register. After register, the nurses are taking the vital signs, and they proceed to counseling services, dental services, laboratory tests, which include blood, urinalysis, and stool. In the second visit, it's the same thing. They come in, register, nurses are taking the vital signs, and at this time, the patients are examining by the physicians. The high risk are examined by obstetrician. The low risk are examined by any available physician. And the rest of the low risk could be examined by the midwives, the nurse practitioners, the MCAs, and family planning coordinators. At this time, during the second visit, confirming of the lab results are seen by the doctors. They are to be treated when it is necessary. Before the patient leaves the clinic, prescriptions are given to them, ferrous with folic acid and prenatal vitamins, and their appointment to come back. The subsequent visits, again, registration is done, vital signs is done by the nurses. The low risk examined by midwives, nurse practitioners, family planning, MCH coordinators, and the high risk are also examined by the physicians or the obstetrician. The low risk subsequent visits are coming on every Thursdays. The high risk every Tuesdays. The labs that are done during their visits, subsequent visits, CCT, that's the glucose challenge test, is done in pregnancy to assess women's risk of gestational diabetes. And it is done at 35 to 37 gestational week. GTM is also done, that is the gestational diabetes mellitus. It is done at 24 to 28 gestational weeks. And at this time, CPC and urinalysis are repeated. This is at 37 weeks. At the end, the prescription is given to them for ferrous and folic acid and prenatal vitamin. An appointment to come back for follow-up. Pregnancy wheel. This is the pregnancy wheel. This pregnancy wheel, we used to estimate the estimated day of birth based on the starting date of the last menstrual period. We also used to calculate the gestational week. We also used to estimate the fundal height. So now we can practice with this. On this wheel, we have the arrow pointing at the first day of the last menstrual period. We also have the arrow pointed to the fundal height, the delivery time, the estimated time delivery of the baby. So if the first day of her last menstrual period is on April 10. So I look for April 10. April 10. April 10, I pointed on April 10, that is the first day of her last menstrual period. Then I'm going to look at the estimated day of birth. Then I will look at the second arrow at 40 weeks. So the second arrow at 40 weeks is on January 15. So the estimated day of birth is January 15. Fundal height. Fundal height is, we measure the fetal development and amniotic fluid. When we measure the fundal height, we measure from the above the pubic bone all the way up to the top of the fundus. So you palpate the fundus. So the fundal height is 25 centimeter, which is equal to 25 gestational week. Then, when you do the leopard maneuver, first you palpate the fundus. When you palpate the fundus, feel for the presentation of the baby. If it is hard, if it is soft, or if you don't feel anything at all. If it is hard, means its vertex, the head is above here. Then you go down to the side. Go down to the side. When you go down to the side, you should feel the back of the baby all the way down to the pubis symphysis. And you feel the part, if it is hard, if it is soft, if it is empty. If it is hard, means the head is down. For you to feel the side, it's important for you to feel the side, so you should know where exactly you will listen to the fetal heart. At this side, I feel the back at this side means The baby's head is here, the back is there, and the legs are here, the arms are here. So the fetal heart rate, I should listen to this side because the baby's presentation is the leg, the back, and the head. And it will be heard on the right lower quadrant. When we do the fundal height, we should encourage the patient to empty the bladder because the bladder, if it's full, it will mask the size of the fundus. And we measure the fundal height in centimeter. So if the fundal height is 28 centimeter, means it's 28 gestational weeks. Leopold maneuver. The Leopold maneuver we use to assess the position, the posture, and the number of fetuses, as well as the amount of amniotic fluid in the uterus. So first, put both hands on the fundus. Feel the fundus. If it is hard, soft, and empty. If it is hard, means the head of the baby is at the fundus. Then you put your hands around at the side to feel the back of the fetus. Then you go all the way down to the pubic symphysis or the pubic bone. You feel it. If it is hard, soft, or empty. If it is hard, means the head is down. The position is the head is down and the position is vertex. It's also very important to feel the side, to feel the back of the fetus, because it will be easier for you to find the fetal heart rate. If the back of the fetus is at the left side, means you will find the fetal heart at the left lower quadrant. If the back is at the right side, means you're going to hear or find the fetal heart rate at the right lower quadrant. If you hear the fetal heart at the upper quadrants, left or right, means the presentation of the baby is breech. The head is at the fundus. Fetal heart. The fetal heart average rate is from 120 to 160 per minute. When you find the fetal heart or hear the fetal heart, you should take it in full minute or 60 seconds. And the patient should lie supine with the legs extended. So it will be easier for you to find the fetal heart rate. You can use either the fetoscope or the Doppler. Nutrition. It's very important to also talk to the pregnant woman about nutrition, the healthy diet. The 3 food groups: protective, energy, and body building, and the kind of food that they should eat to have healthy diet. You can give them example of tapioca, breadfruit, taro, yam, etc. The protective, you give them example as papaya, banana, pineapple, and etc. And bodybuilding, those rich in protein like fish and meat. Nutrition anemia. Nutrition anemia is a condition where the body doesn't have enough red blood cells to carry oxygen properly. And that is if the hematocrit is less than 30% and hemoglobin is less than 11.0. At this time, the patient would feel weak, dizziness, and shortness of breath. And it's very important in order to prevent anemia in pregnancy, we should encourage the pregnant mother to eat the rich food, the food that is rich in iron, and to take their ferrous and prenatal vitamin every day. It's very important to treat nutritional anemia during pregnancy to prevent small baby, premature labor, and very weak mother. In pregnancy, we should encourage to avoid tea and coffee. In summary, antenatal care is a good opportunity to see if the pregnancy goes well and to provide appropriate treatment if there is any risk found, and to ensure safe pregnancy and childbirth. It is important to encourage pregnant mothers to receive antenatal care regularly, both in non-emergency and emergency periods. All of health workers, health assistants, and nurses should provide antenatal assessment in an appropriate manner. I think it's very important to also talk about what you should need in your examining room when you examine a pregnant woman. And you should need pregnancy weight to estimate their gestational weeks and the estimated date of birth. You also need measuring tape to measure their fundal height. You also need a fetoscope and a Doppler to listen to the fetal heart. You also need to have the ferrous and the prenatal vitamin to give them every time they come for their appointment, follow-up appointment, if they run out of the medicine, to make sure they have the medicine throughout their visits. Thank you very much for listening.